University, doula programs, and other health institutions. She is a co-founder of the Seattle Area Black Maternal Health Week celebration and other successful community projects. Rokea feels passionately about advocating and sustaining the effort towards improved health outcomes for families. So thank you for being here tonight with us, Rokea. All right. Now I want to go to Sarah Dixit. So Sarah Dixit is a daughter of Indian immigrants. She was born and raised in Southern California before moving to Spokane, Washington for college in 2014, where she studied sociology at Whitworth University. As a student, she formed a campus chapter for Generation Action, a reproductive rights club run by students for students, and quickly caught the bug for organizing. After graduating in 2018, she began her work at Planned Parenthood of Greater Washington and North Idaho as their community organizer, and has since become their public affairs manager. Alongside her work at Planned Parenthood, Sarah is connected with a larger progressive movement in the Northwest, as she works with APIC Spokane, an advocacy organization for Asian and Asian American community in solidarity with other communities of color. As a young person, she believes that folks of all ages can participate in movement work and that there is profound power in intergenerational and cross-identity solidarity. So thank you both for being here with us this evening. And I'm going to wait. So Tammy Morales, I don't think is here yet, but I will wait to introduce her. Oh, she's having trouble joining the panel right now, but I will wait to introduce her and we'll talk to her when she gets here. But for now, what I want to do is ask some questions of the panelists that we have here right now. So let's start with Rokea. So Rokea, you're doing some really awesome work. I know I've read a lot about your stuff and I'm very excited. So right now, the Tubman Center for Health and Freedom will be the only Black-led and Black-run health center in the region. The question for you is, what does reproductive justice look like for Black people and the others you serve? But also, why is it important to have a place-based healthcare organization?
Yeah, thank you so much for that question. So for folks who may not know, I am the director of community-based research at the Tubman Center for Health and Freedom, which is a new community health organization committed to building a new community clinic that will focus on serving marginalized communities. And so we are very excited. We recently just launched our satellite clinic, which is our school-based health center located at the Rainier Valley Leadership Academy. So we are super, super excited to be starting services and already connecting with community. And so, it occurred to me, thinking about this question, I wanted to help folks connect the dots on land use and reproductive justice. And for me, it's kind of a yellow brick road to get to that connection. I think it's a connection that people often don't talk about or think about. So to get started, I want to kind of identify some shared definitions. And so hopefully this can help root us in the conversation. So the first definition that I want to talk about is, what are reproductive rights? Which is different from reproductive justice. So reproductive rights are your legal ability to make decisions about when and if you have a child. It means that you have the power of the law to protect you and allow you the right to make your own choices about birth control, pregnancy, and having children. Okay, so that's a general definition you could totally Google. Okay, and reproductive justice. So reproductive justice is described as the human right to maintain personal bodily autonomy, to have children or not have children, and to parent the children in a way that we can have safe and sustainable communities. Right. So I wanted to start us off that way so you can think about the expansiveness of what the issue of reproductive justice can bring to this conversation. And I also want to help folks understand how a reproductive rights issue can fall under the umbrella of reproductive justice. right? And so when we're talking about reproductive justice, what we're really talking about are social determinants of health, right? We're talking about bodily autonomy, a safe and sustainable community. So that can include, what are social determinants of health? Where do you live, work, sleep, eat? How are you educated? Your access to education. Also, when we're thinking about reproductive rights issues, when we're talking about social determinants of health, we're talking about your access to healthcare, right? And so those are huge issues. We can also link that to climate justice, right? Your social determinants of health also include air quality, noise pollution, right? Access to food, right? Having food sovereignty. These are the things that can all fall under reproductive justice, right? When we're thinking about access to healthy foods for pregnant and birthing people, right? Or access to healthcare for people who choose to birth or who are choosing not to, right? And I think the other major issue that we need to discuss when we're talking about reproductive justice, and particularly land use, is racism. When we look at the literature, you dig into some peer review journals, there is plenty of research and studies that point to the correlation between racism and social determinants of health. So particularly looking at how weathering, right? So the long-term effects of exposure of living in a racist society or having exposure to racism, looking at the literature, is directly linked to maternal morbidity, right? And so there's a deep connection between those two things. This is why we have King County Public Health stating racism as a public health issue. That's where that comes from, because we know that it has a deep and profound effect on people's wellness. So simply because of the color of my skin, how I experience education, how I find housing, how I find employment will vary greatly from other cultures, particularly my white counterparts. And that's all due to the narratives that we have about Blackness in this country. And so thinking about that, I worked for many years. I worked for about 5 years as a home visitor. And one of the biggest things that we boast about the benefits of home visiting is that it mitigates the isolation that birthing parents often feel. Birth is absolutely a rite of passage. It is an experience that you cannot describe, you can't completely prepare someone for, and you come out on the other side with a new identity, a parent, that you have to figure out how to navigate. And in this current context, parents often find themselves with a brand new little baby alone, or maybe they have a partner and they're trying to figure it out. And so when I tie in this idea around isolation, it connects me directly to displacement, right? Thinking about land use and reproductive justice, we have to talk about displacement. And this is why displacement is a huge issue. When you displace a community, you disrupt those networks of connection and safety and information sharing and resource sharing that communities build, that allow people and whole communities to thrive. And so, I feel I have to say that there really needs to be an amends made in the city of Seattle. Something needs to be done, something needs to be addressed about the amount of displacement that racism and gentrification has caused in this city. And thinking about, again, land use and the needs of birthing people. When you displace a community, when you displace a birthing family, you disconnect them from the support, their network, their community, the things that keep them well and allow them to thrive, right? And so, I'm just taking a minute to look at my notes because I thought really deeply about this, and I feel really passionately about this. And so I want to fast forward now to the original question of why does a place like Tubman Center need to exist? Why do we need a community health center, a place-based community health center? And so when I tie it back to that conversation around displacement, what's happened with the gentrification of the city of Seattle is that it has effectively displaced its marginalized, particularly Black community. The African-American community has become a migrant community in Seattle. We are disconnected from our hubs and our community spaces. And there are folks doing amazing work to recreate those spaces. But essentially now we have a huge community now living in areas that are not prepared to serve them, that don't have the cultural congruence, nor do they have the services set up, and nor do they have the resources at this point. We have a place now where the city of Seattle is the hub, right, of a lot of resources, new programs, new things developing, and the community that needs them the most don't live in the area. So to have a Tubman Center for Health and Freedom means that we are essentially recreating that space where community can come for their health and healing and be well and get the care that they need with providers that see them, provide that cultural congruence, can provide that wraparound support that families need, and particularly birthing families. And so when I think about that question, those are my initial thoughts. So thank you.
Thank you so much for that, Rokea. And I really like how you were able to tie, this historical racism, systemic racism to health, because I do think that that's something that folks don't think about a lot, when they think of land use, thinking about things. I mean, I told you I did environmental work, so I think of environmental racism. So it's very deeply tied together. So thank you again for that. And I just want to pause and say, we're happy Tammy Morales is able to join us. I will intro you, and we have a question for you as well. So Councilmember Tammy Morales is trained as a community and regional planner and has spent her career working in frontline communities on local issues, including things like food security, displacement in low-income neighborhoods, and community-centered development. So thank you so much for being able to join us this evening, Tammy. And sorry for the Zoom complications, but yes, we're happy that you're here. So I'd like to ask you a question now. So you've been a big advocate on, Seattle City Council for what you're calling Seattle in Reach, a 15-minute city. You also just co-sponsored a legislation to make Seattle a sanctuary city for people seeking abortions. What do you see as the connection between this 15-minute city and the access to abortion care and other reproductive health care?
Thank you, Emily. Good evening, everybody. My apologies for being late and having technical challenges. 3 years into COVID, I still can't figure it out. So yes, I'm trained as a planner. And for this last year in my office, we've really been talking about this idea of a 15-minute city. We've been having a series of community conversations that we call Seattle Within Reach. And the vision there really is to create a network of well-resourced neighborhoods where everyone has access to essential goods and services, including healthcare and including childcare, a grocery store, a credit union, the things that they need to be able to thrive in their community without having to get in a car to do it. And so that includes access to high quality, affordable medical care. It includes access to reproductive care, to gender affirming care, things like health screenings, a pharmacy. And that vision really is about intentionally creating healthy, thriving neighborhoods for everybody, young and old. So those are, we've been having conversations about different elements of that. It is really to anticipate the conversation around the comprehensive plan that's happening up for the next couple of years that will really determine how we use land use to serve our neighbors better. And so we've talked about things like, how we create more housing in Seattle that is affordable for working families, how we address our transit system, things like that. What it means is focusing on land use policy. What kind of building do we allow in the city? Where do we allow it? Why are there no small scale grocers in our neighborhoods? Why is there so little affordable commercial space? We worked with the Tubman Center to think about how the plot that they are looking at could be used for the kinds of services that they want to create there. The intersection with land use and abortion care is really an issue of zoning, of permitting and licensing. Here in Seattle, we don't have the kind of restrictions that we're seeing across the country that are literally shutting down clinics in other cities and states. There are, I think the last count, 14, 15 states where it's already illegal to operate an abortion clinic. And the way they accomplish this in the past has been around, either outright prohibiting these services in any kind of zoning area. So you can't operate in residential, you can't operate in commercial, you can't operate in industrial zones, or by making it prohibitively expensive to operate anywhere in the city. So, really high barrier equipment requirements, requiring clinics to be within certain proximity to an emergency room. So there are many ways in which cities have used land use codes and ordinances to restrict or outright effectively ban the operation of these kinds of services. That was pre-Dobbs. Now it's not really about land use anymore. They're just brazenly criminalizing medical providers and people who are seeking abortion care. And so that is why here, at City Council, we've been looking at what we can do as a city to proactively protect what we know is going to be and is already proving to be an influx of people from surrounding states, particularly from Idaho, which is one of the states that has really restricted people's access. So while, here in Seattle and even in Washington, we have a secure right to abortion. We know that many folks from across the country don't. And from a municipal standpoint, it really is about focusing protections that we can, creating protections that we can put in place to extend that care and that protection to people who are crossing state lines. So there is the sanctuary legislation that you mentioned that I co-sponsored with Councilmember Sawant. I also had 3 other bills that I co-sponsored with Councilmember Herbold to create civil rights protections. So adding as a protected class people who are seeking abortion care or who are seeking gender affirming care. So we also created a buffer zone and extended what is currently state law into the city to create a misdemeanor charge for people who encroach on individuals who are seeking abortion care or gender affirming care. So, it prohibits, blocking access, for example, to a clinic, harassing, trespassing, noise, all of those things that have been used in the past to intimidate people who are trying to seek care. And then the last thing is restricting the ability of crisis pregnancy centers to open here in the city. We have, I think there are 2 clinics right now and a mobile clinic. And these are facilities that claim to offer abortion care, but then when you go in, they actually are trying to dissuade people from seeking that care and don't even actually provide any sort of real medical care to people. So we're doing what we can here in the city, and a lot of it is around just providing more protections for people and trying to ensure that folks who are coming from across state lines are protected as well.
Thank you so much for that, Councilmember. Thank you so much for your service. We really appreciate it, and we, appreciate the response. I think it's really comforting to be in a space where, this is actually being taken seriously, and we're doing something that, waiting for other states and seeing what's happening over there and making sure that's a safe place here. So thank you again. But this is actually a perfect lead-in to talk with Sarah, who is working on state lines. So we want to ask you a question next. So how is Planned Parenthood Spokane planning to cope with the potential of abortion refugees from Idaho and beyond? Will you be planning on expanding locations, and does the zoning in Spokane allow for that?
Yeah, thank you for that question, Emily. I don't know if I'll be as beautiful and eloquent as my two other panelists here, but I'll give it a shot. So yeah, with this question, it's such a big one. And for our clinics that are on the east side, which our service areas, everything east of the Cascades and into North Idaho. So we've already seen a steady increase of patients from Idaho in our easternmost clinics. So that would be our Pullman location, which is just 10 minutes from the Idaho border, and then our Spokane and Spokane Valley. And when Roe was overturned, we already started getting calls from patients from all across the nation after they had received the call from their providers saying, sorry, you can't get care in the way that we were planning on for you because of the decision. So it's honestly just wherever there is a place where someone can travel to. So airports or the train station, family. So we're seeing this decision, even though, right, with the 17, 18 states that have outlawed abortion at this point, that this impact is nationwide because it'll impact all of our communities with how we should be thinking about our neighbors and how we should be caring for one another, especially because we know who is disproportionately impacted by abortion bans like the ones we're seeing, right? It's folks of color, it is folks with lower incomes, people who don't have access to 2-3 days off work, right? To travel hundreds of thousands of miles to receive that care. So for us here at GWINY, which is our little acronym, we've been increasing staff capacity. We've hired a abortion navigator, so someone who can specifically talk to patients coming in from out of state and help guide them through just all the loopholes that exist in our systems here in the US. And we also created a hospitality fund so that we can help provide resources for people who are needing to travel, whether that be food, lodging, transportation, the procedure itself, whatever they might need as they're traveling from outside of state. And we aren't currently planning to expand locations, but we have discussed different ideas of what that would look like, whether that is increasing pop-up clinics along the state lines here, or doing more mobile clinics. Right now, the mobile clinics that we do are more in central Washington for rural migrant communities. So for our agricultural workers. So seeing if we can use that model to then expand closer to Idaho. And zoning in Spokane so right now, a lot of our clinics are in commercial residency zones. And we fortunately here in Spokane have a friendly city council, but our mayor is very openly anti-Planned Parenthood and anti access to abortion. So we would expect a fight with that administration, but I think as we have these conversations and thinking about Washington state in comparison to other states that we are neighboring, it's often this idea that, oh, Washington is safe, right? Like, oh, we have all these great laws, the right to abortion is codified, like all these things. But we know rights aren't rights without access. And I think land use really has that piece of what does access look like for our rural communities, for our communities out here in Eastern Washington.
Thank you so much for that, Sarah. Like, seriously, it's really cool what you're doing. I know, especially when that decision came out, a lot of us, it was a really scary, tragic day, and y'all really just, snapped into it and have been doing some amazing work. So thank you so much. So this question right now is for all of us. So it's going to be for all of our panelists here. And then we'll get to a section where folks can, ask their questions from the audience. But I'm going to frame this question first. So Land use policy is both everywhere and that it impacts every aspect of how we live, yet also somewhat invisible because most people don't know about the laws and policies that influence land use. FutureWise works on a lot of different aspects of land use, from promoting housing affordability and redressing the impacts of racist policies like redlining, helping communities find locations for childcare centers, promoting walkable communities where people can get around without a car, and more. So the question for you all is, for the communities that you serve specifically, what do you see as the most important connection between land use and reproductive justice? And what would you envision for a future for what the land use community can do for reproductive justice?
Well, I'll take a stab here. If for those of you who don't know, I represent Southeast Seattle. The District 2 goes from the Little Saigon CID all the way down the Rainier Valley to Rainier Beach. And for the people of District 2, access to healthcare is a huge challenge. The South End doesn't have a hospital. Well, we did just get Odessa Brown Children's Hospital. So that's huge because it is right there in New Holly, where we have lots of families. But as a community that is predominantly Black and Brown folks, there is high health disparities. All of the things that Rokea mentioned around social determinants of health impact the people of South Seattle. There are environmental racism issues, redlining, transportation, global, all of the air quality and noise quality and water quality. All of those things impact the health of folks down here, and that means that there are higher incidents of infant mortality, maternal mortality in our Black and Brown communities. And they're increasing at an alarming rate. So it is really important for us to have, new facilities coming. We had kind of a few public health clinics, but there's candidly a challenge with being able to provide culturally appropriate care given the populations that we have down here. So, it's important that we have the Tubman Center here now. We also have Rainier Valley Midwives, which is I used to sit on the board. I wish I still did. But, providing really important culturally appropriate care and compassion and understanding and the questions about land use. We need more facilities and more essential services in the areas of the city that have historically been underinvested in. And comprehensive reproductive health care is included in that. Abortion care is included in that. People shouldn't have to go to Renton to get access to health care. And so, there is a lot of work that we need to be doing at the state level. And advocacy around that is important too. So we need to strengthen the state law that has the buffer zone, buffer protections for those seeking care. There is, addressing the land use issues in particular, that is part of the comprehensive plan conversation that we're going to be having in Seattle for the next couple of years. And that means looking at the way that we zone, looking at the way we allow small scale healthcare facilities, small scale grocers, the kinds of things that people need to be able to thrive in their community. Many of those things are restricted right now. And so easing up on our neighborhood commercial districts, for example, will allow people to access the kinds of things that they need and to do it in a way that makes their lives easier. And the last thing I'll say is that we have, I know everybody's paying attention to the Supreme Court right now, and we were anticipating and fearful of the Dobbs decision. But there's another decision that they're going to be making soon out of South Carolina. It's Moore v. Harper. I will admit this is something I'm only just learning about, but it is the independent state legislature theory, which would basically give state legislatures incredible power. And it is happening in the same states where they are suppressing the vote and really looking to change the makeup of the electorate. And those decisions are coming down in this term. So things are about to get dramatically worse, which is why it is so important for us here to really be paying attention to these issues and to make sure that in this state, people are voting with these issues in mind. My office and Councilmember Herbold's office, we both sit on the Board of Health. And so we are convening Reproductive Rights Coalition to begin talking about what the policy priorities are for the next legislative session, and look forward to being in touch and sharing with you the things that we are learning, and would love to have you join us in identifying what some priorities would be for this upcoming session. Because I think Washington State is going to be playing an even more important role in making sure that we are able to protect people as these other decisions come down.
Thank you for that, council member. Thank you. And thank you for, keep people aware of what's going on next. So I know I'll keep my eye on that, but I don't know if any of the other panelists want to answer. I can also restate the question too. So what do you see as the most important connection between land use and reproductive justice? And what would you envision for a future of what land use community can do for reproductive justice?
Yeah, I'm happy to jump in on this. Back in, gosh, it was like 2016, 2017, under Ed Murray. We had Ed Murray as mayor back then. I was on the housing affordability, livability focus group all those years ago, having conversations about zoning, having those conversations about land use, and having those conversations about how the city can support sustainability with its citizens and the communities that were already living and inhabiting the area. And so those conversations need to continue. We need to continue revisiting those. I'm thinking about just how a few zoning changes in 2011 have drastically impacted our Chinatown International District community. Vastly different community than how it looked, let's say 10 years ago. And what would it have looked like if, all those years ago when community was asking for a moratorium on building? How can we have mitigated some of these impacts that we're seeing in our communities now? So here we are today, we're beyond that, right? So we need to keep having those conversations around zoning and land use. And for me, I think it's really important that we deeply consider what is our definition of affordable housing. Currently, our affordable housing, while it has definitely allowed folks to re-inhabit and stay within the city limits and have access to, having access to the central district, which obviously is connected to downtown and all those thoroughways where people are needing to move through to live and work. I don't think that affordable housing that we currently have has been the most beneficial for families. I'm thinking about the destruction of the Yesler Terrace. While maybe that property needed some updating, those families went from having access to land and being able to plant gardens in their small yard and having more of a townhome and having more space to now living in a high rise, which is we're on shaky ground, right? From having affordable housing that allows for people and families to thrive to having potentially high-rise projects. And that's problematic for me. So and as a home visitor, I visited all these places. So issues with, roaches, issues with noise, maybe the neighbor downstairs doesn't have kids, but the family upstairs has two. And I can't tell you how many families I've had to support with dealing with complaints because of noise when they're just trying to allow their children to play during the daytime hours. Those are things that we need to seriously consider. I don't think that it is a long-term investment in our marginalized communities to just give them apartments. People need ownership.
Yeah.
We need to support our families with having ownership. That's how we build sustainability. That's how we invest in people, is we give them something that they can actually sustain with and potentially build wealth with. And so that's something that's been sitting on my heart for a long time. And I think, the other issue is that, yes, we absolutely need access to facilities and providers that are available to serve these communities. However, if we don't have enough providers getting into college programs, if we don't have enough trained providers that can actually serve the communities, that folks coming from the communities that they live and hope to serve, right? Like, what are we doing? So we need to seriously talk about how we can partner with our local school institutions and opening up pathways for people to become medical providers. How can we get more Black and brown people in medical school? Simple as that. How do we open up funding for that? And then I think the other thing that I'll end with is Tubman is working to build relationships and identify those providers that we deem safe and are mission aligned with the Tubman Center for Health and Freedom. So we are looking to continue to build those networks because, like I said before, people need a place to go where they feel seen and where they're safe to receive care. And I think it's important for folks to know up front that Tubman is an abolitionist organization. So we seek to create a completely new model of care that we feel offers our community the highest quality of healthcare that they deserve. We also reject scarcity mindset. We know that there are plenty of resources, knowledge, ability, and there are enough gatekeepers out there who can open the doors for us to have the care and services that our communities need, because it's a human right. We deserve it. People deserve it. And if, it's always a conversation I feel like I'm having with folks where we say we live in a liberalist city, right? Seattle's so liberal, we're very liberal. But the undercurrent are some very deeply racist and, very conservative ideals around who has the right to live and where, and who has the right to care and how. And so I'm hoping that in this future, those ideals are challenged. And I imagine Tubman Center with our beautiful standing flagship, a network of providers, having more providers getting in and through the education system, and happy families living together and seeing Black and brown families walking through the streets of Seattle, not the scattered one or two that I see, but like actual thriving communities moving together and enjoying this beautiful city. We live in an amazing place. So those are my thoughts about that. Thank you.
Yeah, I'll just say a few thoughts, but leave it pretty open so that we have time for the Q&A. I think the biggest thing for the question is for us at our affiliate is really making sure that we're paying attention to patients as whole people and not siloing them based on whatever care they're coming to us for. So when it comes to the intersection, right, between land use and reproductive justice, and for us, right, this obviously Planned Parenthood is not a RJ organization. So in community with RJ organizations that are led by Black and brown people, really paying attention to that access piece. So how are people transporting themselves to clinics? So making sure there's a bus stop right at the corner of all of our health centers, making sure that there is ability for ADA accessibility, and for us in Spokane, a big issue we've been having is with noise ordinances with the protesters and with people blocking our driveways and sidewalks. So things like that where it might not be explicitly right, like land use in the obvious way, but how people can use things to prohibit and harass and intimidate people away from receiving the care that they need and they deserve. And for us here in Spokane, City Council recently passed a new like middle housing policy, which we are interested to see how that actually plays out. But yeah, I mean, in terms of what this future looks like, it's so that everyone can live their lives and make the choices that they need to for their futures, and do so with dignity and without needing to compromise based on what society tells them they deserve. And yeah, just really excited for this conversation. I haven't really seen a ton of overlap between land use conversations and reproductive rights and justice. So things like this are really exciting, and looking at the intersection between all of the issues, because we know this requires an intersectional lens, and that siloing movements and issues doesn't help any of us. It really does require people getting involved from every passion, movement, industry. Yeah.
Thank you so much to our panelists. If anyone else has anything else to add, Tammy, I know you unmuted at some point, so I didn't know if there's anything you wanted to add to the question at all.
Well, I was just thinking about what Rokea said about home ownership, right? Like we have lots of ways that we work on investing for affordable housing here in Seattle. We have fewer ways that we really try to support home ownership. And so one of the things that my office has been doing for the last year is trying to have a conversation about what social housing is and what problems it could solve or try to solve. And part of it is getting to this issue of how do we, so the idea is that, we basically create an affordable house, a social housing developer, a public developer. So rather than, any of the affordable housing nonprofit developers that we have in the city that we contract with to provide this construction, the city itself is the developer. And that means that it is publicly owned land. It is publicly owned housing. Not in the way we think about housing projects, public housing from the past, but this is home ownership opportunity, workforce housing, and market rate housing, all in the same building, each, sort of supporting one another. But the idea really is to create high quality housing that is publicly owned, and that's what ensures permanent affordability. Because then we're not worried about the building getting sold and rents going up and people getting pushed out and displacement continuing. So there's a lot of conversation happening right now where, nothing is set in stone yet. There is no legislation that's passed, but it is something that we've been talking about in my office for the last year. In fact, one of my staff members and I went to France last year to one of our sister cities that has a robust social housing program where they're requiring that every project include the ability for working families to stay in the community. And in that same building, there are home ownership opportunities and there are people paying market rates. So I bring that up just because it is one of the ways that we can create opportunity for people, even if folks have, sort of borne the brunt of the lack of community investment, the lack of ability to build generational wealth in their families. It is a new opportunity that I'm really hoping as a city we start to look at seriously, because we do need more opportunities for ownership. so that families can start to build wealth and really ensure that community cohesion that Rokea was talking about, so people stop getting pushed out.
Yeah, thank you so much for that. So if anybody has any questions, we do have about 8 minutes or so left. Sarah, I knew you had a question. I was just gonna ask, you want to just ask the question directly? We've been like chatting back and forth. I was like, wait, what's the question? What is it?
Yeah, can you hear me?
Yes.
Okay, I'll ask the question. I'm in my jammies though, so I'm gonna keep my video off. So of course, the Dobbs decision is really important, and also it's used or narrated as like this sort of flashpoint for like, it's a state change, but like when we think of the Dobbs decision as in without contextualization, like we think of it in isolation, I think it engages in this white feminist narrative that doesn't hold to account like the complexity of the US's history in engaging in like deeply racist and harmful systems of sort of privilege and execution. Like, so I'm curious how we ensure that we're avoiding that simple narrative when we are engaging in reproductive justice work and organizing, like as organizers.
Yeah, that's a great question. It's a big one too. I mean, right, for us at Planned Parenthood is making sure we are not glossing over the history of this organization and over reproductive health in general, right? Of how the birth control pill was tested on people who were in Puerto Rico, right? That it wasn't, and that there's forced sterilizations of people currently happening today in detention centers. And I think just being honest and not pretending like it's always been this empowering thing, that it's really been used as a weapon for a lot of Black, Brown, and Indigenous communities. And even just how we're talking about it now, I think it's really pointing to the resiliency and the ability of communities to build care in a way that is different, right? And yeah, I'd say just really reminding people of the history of this nation is first and foremost important when having these conversations, for sure.
All right. Does anyone else? Oh, Rokea.
Yeah,
Yeah,
I was
go
gonna
ahead,
say,
Dana.
I don't know. I'm still getting used to allowing for long silences on.
I know, same here.
on Zoom. I'm like, oh, yeah, I don't know if I have too much more to add. I think you said that so well, Sarah, that we really need to not ignore the history of you know, I appreciate you naming the history of Planned Parenthood and it being tied to the eugenics movement. Again, the idea of around who has a right to be alive, who has a right to live and have access to care. You know, I just want to remind folks that the reproductive justice movement is people of color led. It's intersectional. You know, it seeks to dismantle barriers to access to care. It's collectivist. And so if we stay rooted in those principles, right, we stay rooted in those ideals, then we can really set ourselves up for, you know, just more. My degree's in MPA, so I always think about efficiency. We always talk about efficiency in public health and public administration. But yeah, you know, like we can really come out all the better and really be more organized. You know, before when there was the leak, right, which I think is so fascinating, this leak on the decision for Roe v. Wade. I was like, what? I've never heard of a leak for a Supreme Court decision. This like blows my mind. So I'm really curious about that. But, you know, I know that some folks were really trying to rally and start organizing, but somehow the energy still felt scattered And at times, personally, I felt helpless, like, gosh, okay, there's the court system that we trust to really guide our whole country. And if they're making this kind of decision, what does that mean, for the rest of us and our power? But again, us leaning into that collectivist, that, working together, and really organizing our agendas and our efforts, we'll keep fighting the good fight. And so those are the things that popped on my heart.
I think the only thing, now that my brain's still thinking, the only thing I'd add is just how much can be done locally. Like, I think just with Roe and with Dobbs, everything feels so removed. Just being like, those people over there are making this decision and we're all stuck. So I think just really turning to state legislatures, city council races, school board, just really paying attention to the power that exists in your communities. And I think the abilities that we have locally to create that change, even if it feels small at the time, we know that it has to start somewhere. And I think that ability to look locally has really helped in terms of realizing for sure that it's a marathon, not a sprint. And so looking at those building blocks of how we increase care and increase community in these ways, and not allowing them to win in what they're trying to do.
I just want to second what Sarah says. As I was saying earlier, I do think it's going to be really important for us to pay attention to what we can do at the local level, at the state level, given that, the news out of DC is probably not going to be good for some time where these issues are concerned. To the extent that we can make changes in our city councils, in our state legislature, and really start to build together, it's going to be important so that we can, as I was saying before, so we can protect the folks who are here and protect the people who will be coming here.
All right. I think I speak on behalf of a bunch of folks, but thank you all so much. Thank you so much for the work you do outside of this space. Thank you for taking this time to talk to us about what you do. But y'all are phenomenal. And we want to keep supporting all the work that you're doing. Folks who are, at home right now, this is being recorded. So I'm sure it'll be on FutureWise's website so that you can share this with people. And, I look forward to doing more research on all the work that you're doing and following your journeys. But thank you so much again for being here this evening. I know I feel really inspired. So yeah, thank you.
Thank you. Thanks for the invitation. And I'm really happy that you're putting these kinds of conversations together.
Yeah, I want to say thank you again for having me, and thank you to my fellow panelists. Really enjoyed sharing space and having this discussion with you all. So thank you very much.
Yeah, ditto to everything. Thank you all so much.
Have a good night, everybody.
All right. Have a good night, folks.